We're here with Dr. Jonathan Dunker talking about hip pain and a torn labrum. Dr. Dunker, when someone has hip pain, how might they know if it's a torn labrum?
So a torn labrum will typically present with pain around the groin area. Oftentimes it will also present with feelings of popping, cracking, and sometimes instability around the hip.
What role does the labrum play in our hips movements, and why would someone want to make sure that they get it repaired?
So the labrum helps with the stability of the hip joint. The hip is a ball and socket joint, with the ball being on top of the femur and the socket being part of the pelvis. And the labrum helps increase the depth of the hip joint to give you stability. People typically would want to seek care for a labral tear, given the fact that it will often create fairly frequent groin pain and oftentimes feelings of instability in the hip.
And what might a patient expect during their first appointment to determine if they have a torn labrum?
So with the initial appointment, we will almost always shoot x-rays of the hip and the pelvis in order to better visualize the bony structures and rule out the bony anatomy as a potential problem for the patient. After that, we will then go through a series of ranges of motion and physical exam maneuvers in order to better determine exactly where the patient's pain is coming from.
What would you say are some common activities or patterns and lifestyles that people have or do that may lead to a torn labrum in their hip?
So a lot of activities that require deep hip flexion, such as doing a high kick or doing the splits, will actually put the hip in a position that can tear the labrum. However, there are other activities that are just simple, routine, everyday activities that also could occasionally lead to hip labral tears.
And what would you say Prevea's philosophy is when it comes to treating hip pain and associated with a torn labrum?
So we like to try to stay as conservative as possible with treating these injuries. Oftentimes, initially, patients will undergo treatment with things like physical therapy and anti-inflammatories. If these fail to alleviate their symptoms, that's when we may need to discuss surgical intervention for the patient.
Can you talk more about what surgical interventions may be?
Yeah, so surgery for a torn labrum typically is an arthroscopic surgery, and that means that we do it through small incisions localized around the hip, anywhere typically from 2 to 4 incisions. We use a camera in order to visualize the internal structures of the hip, and then other instrumentation that allows us to perform minimally invasive surgery to take care of the labral injury within the hip.
And what do Prevea Orthopedics experts like yourself do in the operating room to ensure the best possible outcome for your patient?
Well, before we even get to the operating room, we like to have a specialized plan, and that is put together specifically for each patient. Once in the operating room, we like to make sure that we have everything that we need to adequately take care of the patient's issue. And then beyond that, we like to make sure that we are well versed in the most up-to-date techniques for making sure that the patient's surgery is a success.
And what might the recovery process look like following surgery?
So typically for a labral repair, the patient will be on crutches for 2 weeks, and we won't let them put weight on that operative extremity, which we call non-weight bearing. After a 2-week period, they can typically start weight bearing on the operative extremity, but we try to limit how much hip flexion they do to roughly no more than the position of the hip while sitting in a chair. That is typically the case for about 12 weeks, at which time the labrum has had a chance to fully heal, and then we can usually let patients return to normal activity at that 12-week or 3-month mark.
For a complete list of Prevea Orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.